Good morning and good afternoon to all of you who are joining us today. My name is Dr. Lisseth Rojas-Flores. I am an associate professor in the School of Clinical Psychology at Fuller Theological Seminary and also a licensed therapist. We are delighted that you're joining us.
And my name is Norma Ramirez. I am currently a PhD candidate in clinical psychology, also at Fuller's Graduate School of Psychology, and I'm also a plaintiff in the DACA case. And I am also very happy to have you join us today.
Yes, we are delighted that you're joining us today for this DACA Thriving Tuesday. The name Thriving comes from the idea that we believe that we can create a space where we can highlight our strengths as well as our vulnerabilities as DACA and undocumented folks, especially as we await the Supreme Court decision. We believe that all human beings, regardless of immigration status, can thrive in the midst of uncertainty and adversity, and we're here to try to support you with some tips that we have developed for you.
With that, we also want to acknowledge the context that we're in. We had come up with different resources for you, but because we are now in a time with COVID and with the civil uprising that we're experiencing, we have to modify them and change the content a bit, but the tips are the same.
Yes.
It's just in this context how we are using them.
And so let me remind you, thank you, Norma, for highlighting that. Let me remind you that we have developed a resource that's available to you for free at the Thrive Center website, which is now posted on the Facebook chat. We developed a little accordion with tips, and you can see, we talked about this last week, how you can download the two sides, the back, the front and the back, and paste it together to keep it handy for you as a reminder of some of the tips that you can use to help you through this undocumented journey. We believe in the Thrive Center. The vision is that definitely we can thrive and be fulfilled adults, and that all of us can move forward with our dreams and our vocations and our goals as we move forward. So just wanted to remind you that this is available to you, and this is what we're discussing and introducing today. We have 9 tips here, but today we're going to cover what tips and given what's going on.
So within the context of what's happening, we are going to reiterate what we talked about last time with unhelpful thoughts, and go into physical health, and also talking about survivor's guilt.
Exactly. And it's amazing that it's quite fitting that we're going to be talking about these issues of health, and not just mental health, but also letting go of survivor's guilt in this context. Because clearly when we started preparing this, we didn't even anticipate that this was happening. We didn't anticipate a pandemic. We didn't anticipate a national racial crisis, and that has been brewing on actually for many years, but now it's really at the forefront of what's going on, given the tragic death of George Floyd, among the many others that have before him due to police brutality. And all of this in the backdrop of us waiting for the Supreme Court to decide. The clock is ticking, and all these things are brewing at the same time. I think it's incredible that we're going to be talking about this, because clearly all these events are taking a huge psychological toll on all of us, individually and collectively. And we're all drained, and we're all spiritually depleted, and especially for the undocumented and DACA community, we are more vulnerable, and we need to take care of ourselves.
And we don't want to miss the fact that this, immigration is not just a Latinx issue or a certain kind of issue, but that there are Black undocumented immigrants who are experiencing this at a different level than we are. And so we want to honor that and make that known that this is part of the intersectionality that we talk about with the model that we showed. Um, that depending on where you are, these issues are going to shape our journey and the way we are affected differently.
Agreed. I think that's a very good point, because I think we all experience this stress, and there are many different types of stress. Some stress is good, it gets you moving, it gets you to do things, and some stress is tolerable when you have support from others, and some stress is toxic. And the levels of stress that the immigrant community has been experiencing for a long time is chronic. But now during this unprecedented times, the stress levels are record high. And I think we need to recognize that racism, discrimination, living under the shadows, all of those things are definitely known to cause a host of psychological problems, including depression, anxiety, and other serious mental health problems, but also physical problems, right? Including cardiovascular problems and other physical diseases, besides trauma, which I think we're all at right now. So we want to make sure that you know where we are positioned as a community that has been suffering due to the precarious legal status.
Yes. Um, so I'm also kind of thinking where we should go. I think since we're talking about specifically physical health, um, I'm wondering if we could show the video
Right now.
and then move into talking about um, the survivor's guilt after.
Yes. Now, let me just make a point here. We have actually, we're going to share with you an interview that we want to that illustrates this issue. We have a very brave DACA recipient who has been struggling with her health during this DACA journey. But I think before, as we move into this, I think it's important to realize that some of us have been struggling with health directly in multiple ways, with chronic illnesses, with other issues that arise for us as individuals, but also that as a community, we have been, our health has been at risk due to the chronic stress. And because of that, it behooves us, we have to take care of our health, physical health, and as well as our mental health. One or the other, both have to go hand in hand. And when you take care of your mental health, you're also taking care of your health. But with the physical health, we as a community who is used to not having much access, because we know there are inequities in the healthcare access, that we need to push against that crime. We need to overcome those barriers very intentionally, and not succumb to the internalized idea that we cannot take care of our health because of all these barriers. So we have to really resist by self-caring, both physically and emotionally, to continue in this journey. And I think the case that, like you said, that we're going to show right now illustrates that. But also takes, I want you to keep in mind that some of you may not have experienced chronic illness, but are still at risk if you don't intentionally start to take care of your body, of your soul, of your mind, of your heart in this process. So with that, should we invite, why don't you go ahead and introduce, actually, I think you do introduce our guest speaker. What we did is we actually recorded this interview because, Zoom right now may not be as reliable, and we didn't want to be cut off. So we had this pre-recorded interview for you. After the interview, we'll come back, Norma and I, to make some more comments and tie some knots around these issues. Feel free to post your questions in the Facebook chat, and we'll try to answer as many as we can today during this live session. We'll obviously continue to answer them as well later on if we don't get to your question. So with that, I'm going to have
I'm really happy and excited to have with us Kathia Soltero Calderon. She is currently a caseworker with Juvenile Justice, where she helps teens remove their charges in a divergent program. She is here with us today in particular because she has been impacted by a chronic illness, and she is going to share her journey with us as she has gone through the medical healthcare system as a DACA recipient. So thank you so much for being here with us.
Thank you. Okay, so I will begin with my experience as a minor with healthcare. We didn't really go to a doctor in the United States, and I grew up not knowing, where to go if I needed the healthcare, and neither did my parents really. As a college student, my community college that I attended, CSN, did have some aid in that they had a mental health, but there was no physician on campus there. When in the summer of 2015, when I was 19, to balance school and also paying for school as a DACA recipient, I had to pay for everything up front. I had to do part-time jobs. This meant that I didn't have any benefits. I didn't get the healthcare from working more than 40 hours a week. Yeah, so I remember at the time I asked my mom if she knew anywhere I could. So eventually she helped me find that old clinic that I went to when I was 14 years old, even though I was 19. And that's because, that's the only thing we knew. So that's where we went. So I went there to mention because these menstrual cramps are starting to affect my job and my school. I would have to miss, a day of work here and there. And that was starting to affect how I did in school and how I did in my workplace. And that wasn't something I felt comfortable with. So I went out to seek help. In this appointment, when I was speaking to a doctor, I mentioned what I was here for. And towards the end of the appointment, when the doctor was about to leave, my mom did that whole thing, where she brushes your shoulder, I guess, and mentions, hey, mention that one thing, right?
Gives you that cue.
And so I said, oh, yeah, that's right. So I also have a lump in my throat that my mom noticed about 2 weeks before the appointment. So I mentioned it to the doctor kind of offhand, right before she left. And I remember she looked at it, felt it up a bit, asked me some questions, and then she referred me to, it's called an ENT, ears, nose, and throat specialist.
Mm-hmm.
She referred me to the one that they had on hand, which was a lower cost. So I decided to go. And in the appointment, ENT referred me to get an ultrasound. When I went to get that ultrasound done, the ultrasound specialist did a biopsy right. So I got that biopsy done. I left. I didn't really think much of it. I didn't think it was anything until I got a phone call from my doctor. So he called me and told me that I did have a little bit of thyroid cancer. Thyroid cancer, as soon as I heard it, I really kind of panicked a lot. It's very scary to hear that word, cancer.
Right.
And in he did mention, that it's very low risk and it's very contained. But I didn't know anything about any of this. So in my head, I thought, oh my gosh, this is so scary. What's happening, right? So as soon as that happened, I was I was scheduled for surgery and I went in to get more tests done. At this point, I was already over $4,000 into tests, that biopsy and ultrasound and blood work and all these things.
And you were having to cover those costs?
Yes, I was having to cover those costs. Once we started going to the hospital and to the surgeon and to the anesthesiologist and all these meetings, I was basically told by the hospital that the surgery wouldn't be performed unless I paid about half of the cost. The surgery the surgery itself was about $30,000. And I didn't have $15,000, as most Americans don't, Uh, so my mom and I kind of panicked, we didn't know what we were going to do. But I remember we just went on to work to get that money. So one of the things we did is fundraising. We did a kermes, which is basically where a bunch of people from your family and friends bring dishes of food, and then you sell that food to people, whoever wants to come by, and they can pay what the food costs or they can pay more. And then after that, I also started a GoFundMe account. I believe that raised about $1,400 or $1,500, but I'm not sure. Um, and we also, my family, half of them are Catholic and the other half are Christian. So what they did is they would ask their church groups during every mass to donate if they could. That also got me a couple $100. We also did a car wash. One of my uncles, he had a portable car wash machine. So I believe all in total with these fundraisers and donations and everything, we got about, I think it was $6,000, $7,000, I'm not sure. But I think it was about that much, including donations and everything.
I am so inspired by the way that you were able to move such huge community to rally to support you in such a time of need. I mean,
Yeah.
how creative you were to circumvent the challenge of getting the money to finance your medical care. Amazing inner strength. I'm so very moved.
Thank
Dance.
you. Yeah. So one thing that I did that we didn't know we could do, I guess, is what we talked to the hospital, and we talked to my doctor, and we talked to nurses and everything. We mentioned this to a lot of people. And because we didn't know what to do, we didn't know who to go to, this was something that no one in my family had ever experienced before. So I didn't know who to get help from. So what we did is I talked to my doctor. I told him about it. I don't remember what he said. I don't think he had any tips, but the hospital, I remember, had some advice as to how to go about, making sure this wouldn't cost more than it already did. So I got the surgery done. They removed the thyroid. After a couple tests, a couple months later, and an ultrasound, it was found that completely clear of the cancer. So that was really nice to hear. After the surgery, I did get a full-time job that was more flexible, and I got benefits. I went to various doctors. One thing that no one really tells you when you're undocumented and first one in the family that actually needs to go to a doctor is that you can change your doctor. And it took me about a year to figure that out. I had not problems with my doctor. I just I noticed he took on a lot of cases. One of the things I didn't like either is that I felt like I wasn't being heard with my symptoms. Having after the surgery, I developed hypothyroidism,
Right.
which is a lack of enough thyroid hormone, and that's again because they removed half of my thyroid that had the cancerous part. So I felt like I wasn't being heard by my doctor when I told him, like, hey, I noticed these changes in my body. I know I look the same, but there's definitely.
So you have to learn how to advocate for yourself.
Yes.
Once you have the means to have medical insurance, even then things like that didn't come easy. You have to learn to that you could request, that you could demand, that you could advocate for better services. Yes, I hear you.
Yeah. One of the things I did is I joined a Facebook group for hypothyroidism.
Good for you.
And that's where I learned that I could change my doctor and I could try. So what I did, and by the third time, I got a doctor that I really liked. This doctor was very patient. He listened to what I had to say. He ran blood work and did exams based on the symptoms that I told him, not just based off what he thought, I guess, or what the blood work said. It's also he heard what I said. So that was really nice. I had a doctor that actually heard me, listened to me, and it was a very different experience. How patient and how smoothly the appointment went. I felt like I wasn't being rushed in and out of there. So that's the doctor I've been with for more than 4 years now, I think.
And you are, you kept insisting, you kept on persevering in terms of asking for questions and trying to figure this thing out. I am very impressed how resourceful you are, that when you didn't know, you look up a Facebook group that can give you tips on how to go about this issue. And kept being persistent about asking for the services and the dignity in treatment that you required, that you needed, and that you wanted.
Yeah. Yeah, I did. I made sure I had someone I felt comfortable with, and it took, joining that Facebook group to realize, that I'm not saying bashing any doctors or anything, but if you don't feel comfortable with your doctor, that I can change that. I didn't know that. I thought, the doctor's orders were law, that I had to just, the doctor said this and that was it, so it took me, hearing other people's stories to realize that. Yeah, and then in post-surgery, aside from that thyroid specialist, which is kind of the only doctor I saw for a long time, I started going to a general doctor to get other general tests yearly done. But one thing I always recommend to people is to ask their university. If you're a student, a lot of universities do have a clinic. The university I transferred over to did have a clinic for students where I went to get help when I had a cold, when I had a flu, stuff like that.
Get the preventive care.
Mm-hmm. And also nonprofits. There's a lot of nonprofits nowadays, way more than back in my days when I was dealing with this, that are helping with these types of situations. And if they don't help you, then they can direct you to someone that can. The consulate here actually opened up a health panel, I believe.
Mm-hmm.
And it was a couple years after I went through this experience, but I think it's really nice that they can, tell you what resources you can access as a Mexican citizen or as a non-citizen here. I don't know if every consulate will have this, but I know that mine does now. They didn't back then, but they do now, and that's really nice. You could always reach out to your consulate, to your local nonprofits, and to university.
Right. Thank you, Kathia. Kathia, these are fantastic tips for folks that are listening. Because yes, it takes a while to figure out the system. The healthcare system here in the United States is complicated, complex, and we all struggle to get the proper services. But even so much more when we have precarious legal status, right? You're pushing against the grind, and many challenges and barriers. But the tips that you are providing are fantastic in helping us figure out ways to circumvent some of those challenges.
To those people, I would say, you know your body better than anyone else. And if one doctor isn't listening to you, isn't accepting the symptoms that you are expressing.
Thank you, Kathia, for sharing your story and for being so bold, and also for your transparency, because as you share your story with that level of detail, you're also giving a gift to many others who are perhaps feeling ashamed or for some reason feel stigmatized about talking about chronic illness or whatever other health challenge they may find. So your boldness and your testimony, in a sense, is an affirmation that yes, we have the worth. We have resources. Yes, they might be limited, but we can circumvent some of those with creativity and with the amazing community that you were able to rally, and the family that we have. There are challenging situations, but health is very, very important as we move forward in this journey, and as Norma said, as you continue the fight. Thank you for joining us, Kathia. Blessings to you. Continue to take care of yourself. Continue to be an advocate for yourself, and I know you are being an advocate for others as well.
We're delighted to have you here, and we wish you the very best.
Thank you.
Again, we thank Kathia for her inspiring story, and for you who are listening to our attempts to communicate this important message about taking care of our health. I think in spite of the inspiring story, I recognize that these topics are heavy. We're talking about cancer, we're talking about health inequalities, we're talking about racial injustice. All of this together in the middle of a pandemic weighs very heavily in our hearts, and we feel it in our bones. So I think it's important to pause for a minute, take a deep breath. Take a deep breath from your belly, breathe like a baby, center yourself so you can continue hearing some of the suggestions, some of the potential things that you can do to regulate yourself in a time of disruption. Take a deep breath from your belly, hold it in, let it out, feel the air filling your lungs, feel the air coming through your system all the way to your brain, allowing you to think a little bit more, to calm yourself, so we can be moving forward. We recognize that these are heavy topics, but there are some lessons learned, and I think Kathia made some great points. Normally, do you want to highlight some takeaways that Kathia made?
Yeah, definitely. I think something that, always strikes me is like her inner strength, throughout the whole process. Even with getting news like that, um, it was an immediate, piece of like, okay, now what are we going to do? And with that, the resourcefulness that comes about from that, um, the lack of access to healthcare didn't stop her. She tried every which way she could to get that funding. And then there's the piece of advocacy that in whatever ways that she could, and as she learned more, her advocacy became better and better for herself. Um, and so those are some of the three takeaways that I think really stand out from her story that she shared with us.
Right. And I think it's important because, us undocumented and documented folks, oftentimes we don't have the same experience in assessing care. And so we have to develop the habits of doing the research, trying to learn how to maneuver insurance, hospitals, how to even talk to doctors, and require the respect and dignity that you need in assessing care. So those are habits that need to be practiced and developed as you move along. So yeah, that's a very good point that you're making, Norma. For me, what struck me was this dance that was happening in terms of her individual strengths, her resourcefulness, but also the community and her family backing her up, right? How the community rallied behind her.
Just real quick, your mic is yeah.
Can you hear me then? Thank you. Sorry. What for me, what caught the attention is this dance between her and the community walking with her, walking behind her, walking beside her in very practical ways to ensure that she got the money, the resources to be able to get the services that she needed. And that in other times she did it herself, and both complemented each other in really arriving to a solution that took care of some of her immediate health problems. To me, that's so powerful, because right now we're all being affected individually and collectively by all the trauma that we are facing with these unprecedented events, the pandemic, the racial injustices that are just spilling all over the place, and are pinning us sometimes one against the other, when in fact it shouldn't be. But for us as undocumented folks, sometimes we have to kind of wrestle, right, with where are we going to stand in all this,
Yeah.
and what kind of stand are we going to take in a situation like this. But what are some of your thoughts, Norma, in maybe just stand together on this issue?
Yeah, definitely. I mean, I think that we definitely need to make a stand in terms of anti-racism and anti-Blackness. That needs to be clear. I think the question is about how do we do it? Because we have the additional, intersectionality with precarious legal status, we have to think about what this looks like for us. So for some, you may be able to go out and protest. But for some, that might not be an option. And so I think we have to stop and really think and reflect about what this means for us. And it's important to emphasize that our undocumented status shouldn't be a reason to stop us from participating. It's about how we do it. And taking into consideration also the pandemic, what it means to go outside and be a part of a protest when we may have other family members who are maybe are not in the best of health, right? And what does that mean, and so forth. And so I would say that one, uh, obviously stop and think about what it means for you, but also understand and that there are other ways in which we can participate and act. You know, one of the ways that we are doing it is by bringing this up to the attention, right, and stating that um, anti-Blackness and racism needs to stop. And so, what are the other ways in which we can bring that about with when maybe protesting is not an option?
Yes, no, very good points. And I think that the take-home message that we're trying to convey is, we know that our community has been hit left and right with chronic stress, with many demands, and we're all kind of walking around with a hyper stress, hyper alert all the time. And that we must intentionally have to regulate ourselves constantly to reduce some of that stress, to unload some of that stress, to unload some of the guilt that comes with, well, should I go, shouldn't I go? What can I do? Because I think that we can transform our anger, we can transform our grief, we can transform our rage and our outrage of this, what's going on, in ways that um, that restore our soul and keep our values and our messages consistent. Um, and the idea of stopping and kind of taking stock of your thoughts. What is it? What's going on? What are your automatic thoughts? And those unhelpful thoughts that we mentioned before that sometimes get things blurry. How can we bring some flexibility there? What are our options? And what is it that you can do? For some of us, we might be taking care of elderly in the family, folks in our community that are higher risk, or we myself be in situations where we already have a chronic illness, and therefore we have to take care of ourselves in this pandemic, and which is one thing that makes it different from previous protests, right? Because we had undocumented folks before going outside, rallying, and all of that, and yes, they were exposing themselves given the undocumented precarious legal status. But now we have an elevated risk. This comes with health. And I think we need to stop and recognize that, take stock and decide, okay, is this something that I can do? And if who is in my circle, who is in that community who's standing next to me, who is on my back that I need to take care of? And if I choose to go, then I need to take all the precautions, right? Wearing the mask, keeping the distance, ensuring that you have that you're following some of the basic protocols to safeguard your health. Very, very important. And aside from that, I think doing the research ahead of time, as undocumented folks do, with consultation with some legal groups, as to what is it that you have to do to take care of yourself, because we know ICE is around, and you can't get detained. You can be detained. You can be arrested. So what kind of precautions can you take? We're both not legal lawyers, obviously, but we know that there are protocols for these kinds of things. So the idea that we're trying to convey is really stop. Don't go on automatic pilot. We have been going on automatic pilot a lot because of all the stress that we're feeling. Look at your options and then make informed decisions. For others, of us that are not in high risk, we might want to go and walk out. That's fine. Wear the mask. For the ones that are having to stay home, then do some of the things that uh, that you can do from home, supporting financially, supporting through dissemination of information. What other things can you do from home, Norma?
Well, right now there's a Blackout Tuesday that's happening on social media, so that to make sure that you're amplifying Black voices and not these other things. Um, and really, what it, to stop and reflect and do the anti racism work within yourself. Like, what does that look like with your friends and family? So these are all things that we can all participate in. And I think this brings up our other point that we haven't touched on about survivor's guilt. I think that sometimes this mixture of, you know, um, that it's not happening to us, that we need to do something, may blind us to making these thoughtful decisions. It could further propel this automatic pilot that sometimes we experience. And so again, the stopping and reflecting is a one way to identify what's really happening with us, so that way we can take the best decision. But also, it shouldn't stop us from taking care of ourselves. Um, when we live with a system that is constantly trying to oppress us, rest and taking care of ourselves is a form of resistance. We live another day, and that's what the system doesn't want. And so it's important to emphasize that as we're going through a pandemic, as we're going through all of these um, things that are happening all at once. Taking care of yourself and resting and doing what is good for you is revolutionary.
Indeed, yes. And those are the words from Dr. Thema Brian Davis, who says self-care and rest can be revolutionary, and self-care and community care are soul foods. Feed your soul during this times of dryness. Feed your soul during this time of difficulty. Take care of your health. Take proactive little steps. It doesn't, they can be little steps. You don't have to invent the world and the wheel. You have to do little steps to take care of your health and take care of the health of others in the process. We're here for the long haul, and recognizing the precariousness of our status, recognizing the inequalities of healthcare, recognizes the health disparities by race, by gender, by legal status. It's important. We have to be very realistic. We have to recognize what we're fighting, the monster we're fighting, right? But also recognizing that we have a tremendous resilience as a community, as an immigrant community that comes from within. If we dig deep to pull that resilience out, if we reach out to our family, to our community who can walk with us during this time and difficult times, if we reach out beyond our immigrant community to ally and support our Black brothers and sisters, all of that is empowering. And we need to push back against the disempowerment of structural adversity to thrive, right?
Yes. And I think as we're getting closer to our time today, we want to emphasize that we are definitely open to your questions, your feedback, so that we can answer them and give more in-depth information if needed. But also in the coming weeks, as we continue this, we would love to hear from you.
Yes, thank you. We welcome you to check our website regularly, because we're posting our recorded Face Live conversations there. We're adding other resources as well, and we are trying to answer some of your questions. This is evolving. We're not predicting anything because everything is rapidly changing. But one thing we know is that our community is strong, our community is resilient, our community can thrive, and if we are more intentional in taking care of ourselves in the midst of all these challenges. We are walking with you. We're with you in this fight. We are praying for you. We're rooting for you, and we're hoping that these resources are helpful to you. If they are, please distribute them on your circle of friends, make them available, reach out to us with any questions, concerns, suggestions. We are more than happy to take them. We hope that you move forward by taking care of yourself, giving yourself the permission to rest, to self-care, to restore, to continue, to refuel, to continue the fight, especially as we await the decision of the Supreme Court. Blessings to all. We're going to end.
Thank you.
Thank you.